today I want to talk about technology and medicine, technology in medicine. So I think most people are starting to understand that, hey, more and more technology is coming out is making our lives better. We have this big AI push going on, but what's going on in medicine? So there's not a lot of big technology things going on in medicine other than you hear about robotic surgeries being done, and hey, a doctor can do them either right there in the hospital or remotely, and I think that's great. But I think what we're losing the fact of is there's ways in which you can heal and recover without having to have surgery. So our company Go for Recovery is all based on how do we fix your musculoskeletal problem, your joint, your tendon, your ligament injuries without doing surgery. And I've been doing this for an extended period of time. We've had this up and running almost 10 years. And most people are surprised, like, oh, you can really do this. This is really possible. And the answer is yes. And most people, I think there's a reluctance to think technology can actually heal. And I use a quote that Peter Thiel mentioned. He said that anything that advances a field is technology. And in medicine, we really haven't had, especially in musculoskeletal medicine, we really haven't had a big advancement, right? Surgery is still surgery. Yeah, we're putting in titanium versus stainless steel. Okay, great. But we're still cutting the skin. We're damaging tissue. We're doing sutures to repair, and all of these things are considered advancements. Oh, we got this different type of suture, and we can now I can put this little thing on your skin, and it's a zipper, and I can just sew you up. Okay, fantastic. Is that really the advancement and technology we're looking for in medicine? Or is that even an advancement, right? What if I don't have to cut the skin? What if I don't have to break the skin? What if I can take the same structure, your damaged tendon, your damaged joint, your damaged ligament, whatever it is, and repair it without ever breaking your skin? What if I can just use different types of tools and mechanisms that we can apply in using, we call electromagnetic forces or energies? What if I could just put that on your body and then watch your body recover? Well, that's what Go for Recovery is all about. We specialize and we have a patent on treatments using 4 very specific electromagnetic devices that allow us to stimulate the body, allow us to start making the body heal on its own. And so we can stimulate what's called mitochondrial activity, and that mitochondrial activity will wake up the cell, start vibrant activity, start DNA production, building the proteins that we need. We can stimulate in the body what's called tissue-specific stem cells, right? All our body has all over it tissue-specific stem cells. And people are like, well, that's stem cell therapy. No, this is in your body. We stimulate in your body. We don't take anything out, and we don't have to put anything in because your body already has it. We just need to activate that stem cell, wake it up so it can start to work. And this has been well proven. Long before I started my clinic over 10 years ago, doctors had been doing this and showing that our body will release these stem cells when stimulated correctly and can start repairing back tissue back to a normal rate. So this is not new, it's just the technologies have improved to make it that much easier. And so say you're sitting there fighting a tendon issue or ligament issue. Maybe it's a rotator cuff. Maybe it's a bad knee or a tweak to the knee, and someone says, "Oh, I think you got the medial collateral ligament, or you did this." Or I'm listening to the news with all the football players getting hurt. Oh, they pulled this tendon, they damaged this tendon. They're going to be out for 6 or 8 weeks. Why? Why? Right? If we can stimulate the body, right, and stimulate the function of healing, then we should be able to get those people better. And this is what we do at Go for Recovery every day. Every day, people come in and say, well, I went to my doctor. They say I need surgery. This is my third opinion. Can you do something other than this, right? And so the answer is yes, and we do it every day. People don't understand that our body is designed to heal, and there are key devices, key energy-based devices that allow us to stimulate cell function, stimulate stem cell function in your own body. stimulating a healing process that creates normal tissue, not scar tissue. And we can do this in a very short period of time. You're talking most of the treatments that we're doing are going to be between 10 or 12 of these treatments twice a week. You're looking at 2.5 weeks and you're done. Surgery, on the other hand, is you go in and you get the surgery done, and people go, oh, there, we've finished our job. We're done. No, now you got a 6 to 9 month process to recover. And so the battle is, do you really want that 10-month recovery to fix the same problem we can fix in 2 weeks? Do you want to continue with your activities and continue to play tennis and pickleball and golf and go for your hikes and do the workouts that you're normally used to? Or are you ready to take that 10 weeks off? Are you ready to take that 3 months off? Because the surgery requires that. And when you recover at that 3-month mark, you're not recovered. You're healed from that surgery, but now you have this another 3-6 month strengthening process that you go through. Well, we're done. My patients are long gone. They're out living life. They're enjoying life. They're back to their hiking. They're back to their climbing. They're back to playing tennis. They're back to golf. They're back to pickleball. They're back to being active. And most of the time, they don't even have to stop any of that, even though they have these severe injuries and they're told they need surgery. Our technologies, our electromagnetic technologies, allow us to make the body heal and recover at a high level. And then people say to me, oh, well, that's great, but that probably doesn't last that long. The patient I started with when I started this clinic over 10 years ago is we had severe failure of Achilles tendon structure in her ankle. She had 2 surgeries that failed, and that person now, more than 10 years later, is retired and playing tennis every day. 10 years later, no problems, not stopping. Why? Because when we repair your tissue, we repair it back to a healthy state. The surgery was only able to create a wound that everybody hoped would make this tendon heal, and it didn't heal well. So she ended up having 2 of these surgeries, and after 2, no surgeon's going to touch her again. So she would be limping and in pain and suffering because she couldn't heal that, right? Where our treatments in a short period of time restored her back to normal, and now she's playing tennis daily. 10 years later. So this isn't, it only lasted for 4 or 5 months. If we treat the body correctly, if we stimulate the body correctly, the body wants to recover at a full level. And this is another thing that people are not aware of. You can heal without scars. This is well documented in the literature. You can heal without scars. And they go, there's no way. Everybody say, I can hear people like that. No, after you have an injury, the only thing you get is fibrosis. That's all you can do. That is not true. You can heal without scars. We prove it every day. And we prove every day we can get rid of scars. So if you have bad scars and you went through that bad surgery, we can remodel those scars and restore back that tissue and restore back healthy function. This is what people are unaware of. Technology has advanced in medicine, but they go, oh, well, surgery's doing this, or surgery's covered. Okay, do you want prehistoric medicine or do you want high-level technology medicine, right? And I don't argue with surgeons as prehistoric. It's just the idea that if someone offered you a bicycle or someone offered you a Bugatti, which would you choose? Both are transportation. One's a lot better than the other. One's an old-fashioned type of transportation, and the other one's a newfangled type of transportation. Which do you want? Do you want the new technology? Do you want a Tesla that'll drive itself, or do you want a unicycle that you can just pedal through the right? What I'm saying is, what technology do you want to buy? And the technology makes the difference. And so in medicine, we have technologies to make you heal. And we can heal tendons, ligaments, muscles, joints, bone injuries. So people go, oh, I can't heal a fracture. No, the bone's broken apart in multiple pieces. Yeah, I need a surgeon. But if you contuse the bone, if you bruise the bone, if you crack the bone, you don't need surgery. And our technology will help that. So I think be aware, understand, Go4Recovery is a technology company. We are a health technology company bringing to the market technologies that allow us to have far more success, less downtime, reduce pain, reduce any surgical complications, reduce the need for drugs, and allow you to get back to life and restore back your health and function for long term. So understand that there's a new sheriff in town and this technology works.